Mental Health Awareness Month has been observed in May in the world since its inception in 1949. During the month of May, the government, its affiliates, and other organizations interested in mental health conduct a number of activities which are usually based on different themes.
No one is immune to issues related to mental health. Nothing like the COVID-19 pandemic that brought that out to us. We need tools in our toolbox to not only help ourselves, but other individuals, our family, our loved ones, our neighbors, if you're in academia, our students, the list goes on, but no one is immune to that. And whether it is being anxious or whether it is suffering from depression or another mental health illness, we cannot, again, we can't be afraid to talk about it. There's enormous stigma when it comes to mental health issues. And because of that stigma, we tend to suppress those conversations and the dialogue about mental health. What is it? What can we do? What are the resources? And when people are afraid to reach out for help, then some really serious consequences can occur. We don't want that, and it's time to stop that as a community. So what we do at Owensboro Health with our communities is really partner for those dialogue, those important conversations to not only increase the number of resources, but to be able to educate on what those resources are for you, for me, for all of our loved ones, for the communities that we serve. We've got to have the conversation. So in honor of May, which is National Mental Health Awareness Month, we need to build tools to thrive, and we want to be a partner to that.
In Kenya, it is estimated that 1 in every 10 people suffer from a common mental disorder. The number increases to 1 in every 4 people among patients attending routine outpatient services. This is believed to be because a lot of youth suffer in silence.
And you realize that everyone talks about mental health in a different sense. Everyone has a different definition of what mental health is. Young people are really suffering in silence, and that's because our communities don't know better, our societies don't know better, our elders don't know better.
At the height of the pandemic last year, the president ordered the formation of a task force with the primary mandate to study the status of mental health in the country.
The other issue that I think has come out very strongly in this conference is the need for us to once again refocus on mental health care. We have seen that this is becoming an increasing problem, as I have mentioned in the past, an increasing problem in our country, amongst our people, especially our young people. There is really a need for us to refocus our efforts and redouble the work that we're doing to help and to work with the mental health of our people. And towards this end, I really want to say that it is not just the relatives or the health workers, but it is the population at large. I mean, there has been a huge impact as a result of the lockdown that we have had on our young people who have felt restrained and constrained from the liberties that they know. And this has seriously affected the health and well-being of our young people. So I think that there is need for this, and there is need for a focus on this. And towards that end, without even waiting for the national conference, I do hereby direct the Ministry of Health to begin working on an active plan that they can present to us when we have our national conference on how we are going to deal with the issue of the mental health and mental well-being of our people.
In its findings, the task force led by Dr. Frank Jenga found out that depression and anxiety disorders are the leading mental illnesses as diagnosed in Kenya, followed by substance use disorders, with alcohol being a major contributing factor.
Among the different types of substances, alcohol contributes to the largest burden of substance abuse-related illnesses in Kenya. Of great concern, alcohol abuse is most prevalent in the 18 to 29 age group.
This year's mental awareness theme is Tools to Thrive. aiming at providing practical tools that everyone can use to improve their mental health and increasing their resiliency regardless of their personal or societal pressures.
Pain of the stigma that is associated with mental illness. People are so afraid and shy of indicating that they are human beings who suffer from, say, depression or schizophrenia or PTSD, that they would rather stay with their illnesses at home rather than expose themselves to the shame of confirming that they are humans and suffer from mental illness.
So what is mental health?
Mental health is a complicated area to study. It is extremely integral for our personal well-being and health, and can be affected by so many things like the community you live in, your access to care, sexuality, whether or not you use substances like alcohol, tobacco, or other drugs, if you've moved between cities and countries, and even how and why you moved to your new home.
This prompted us to find out from the public what they consider as being mentally healthy for oneself, mom, father, or friend.
Be mentally healthy. Just being able to be normal and to accept whatever comes in life.
Good mental health is when you can feel free to speak out whenever you are in a problem or whenever you feel there is something not going the way you planned or the way you expect things to go.
Experts argue that the absence of mental illness does not mean someone is mentally healthy. This prompts for more care when dealing with this matter.
No less an authority than the World Health Organization has said that there is no health without mental health. So from the very highest levels of healthcare, there is a recognition that you cannot truly be a healthy person without attention to mental health as well. And while we're all familiar with mental illness, the absence of mental illness does not necessarily mean that someone is mentally healthy. What are some of the components that go into being mentally healthy? Being able to understand yourself and what your needs are, what your emotions are, and so on. Being able to communicate your needs to others, hear what they have to say in an empathic way, and to be able to resolve differences there. It's important also to know how to cope with challenges in life and also how to be resilient, a skill that we can learn. And so it's very important for us to all work together to incorporate mental health as part of our overall health profile.
Kenya has a high burden of mental illness due to ill health, psychosocial disability, and premature mortality, with huge gaps in access to care.
Is in part driven by the low resources that we associate or give to the treatment or to the management of mental disorders. And one of their recommendations, of which we have many, is that really if we are going to give mental health the dignity that it deserves, we really need to finance mental health services in a way that is commensurate with the burden that is there.
Majority of Kenyans associate mental health and mental illness with negative narratives, leading to low focus on the importance and benefits of mental health and well-being. How can this be addressed?
Training and ensuring that we have the top-notch facilities, resources in mental health care. Because by the end of the day, there is not one person who is designated as an individual who can become mentally ill. We are all candidates, and we can all, not to coin a phrase, get it.
The government is committed to building an ultra-modern facility to tackle mental health, and this is also expected to be replicated across counties for the first time, bringing a ray of hope in this matter.
To institutionalize this initiative, I have issued an executive order establishing an ultra-modern national mental health hospital and also elevated Mathare National Teaching Referral Hospital as a semi-autonomous specialized hospital, and I shall be looking to this House to support in the funding of this facility. The East Africa's premier mental health facility will be established to offer training, research in psychiatry, specialized psychiatric services, forensic psychiatric services, child and adolescent mental services, and substance abuse related and addictive disorders treatment and rehabilitation services.
Recognizing stress and mental health problems is not easy. Most people hide and suffer in silence. It is important for people from all walks of life to be vigilant and lend a hand any way they can.
What needs to be done more is, as young people, we need to really speak out more about mental health. We really need to come out and say, yes, I am going through something and I am not mentally stable, and it's very much okay.
You're hurting now, and when time passes by, you know that life's never gonna be the same. You know I've been feeling down.